AI, it's too scary. I'm not sure I like this whole idea.
Healthcare is one of the most underserved industries when it comes to AI adoption.
What I see AI as a tool to make us better clinicians overall.
Hey everyone, welcome back to AI with Bry, the show where we're cutting through the noise and helping leaders learn, leverage, and lead with AI. I'm Brian Dunstead, and you can think of me as your Chief AI Officer, helping you find your path. Each week, we're bringing someone who's navigating this AI shift from the inside, not just observing it, but actually living it in the work that they're doing with their teams. Today, I'm really excited to welcome Dr. Lynn Rapsilber to the show. Lynn brings something to this conversation that I think is genuinely underrepresented in the AI discussions that I'm in on a regular basis. It's the healthcare entrepreneurship lens. And it's not just like healthcare in theory, but what it actually takes to build and run a practice, navigating policy and serving patients in the real world. Lynn is the co-founder and CEO of the National Nurse Practitioner Entrepreneur Network, NNPEN, a community that she has built to give NP practice owners the business education, advocacy tools, and peer support that they never really got in their clinical training. What I keep seeing is that the healthcare is one of the most underserved industries when it comes to AI adoption. And it's not because the need isn't there. It's just because the people closest to the patients are the last ones anyone really thinks to equip, in my mind. So, Lynn, I know you're on the front of changing that. So welcome to the show. And I'm so glad you're here.
Oh, thank you, Brian. I'm really excited to be here and talking about a subject that's kind of it wreaks a little bit of anxiety in clinicians across the country. We hear all the time from our NP colleagues about, AI, it's too scary. I'm not sure I like this whole idea.
Mm-hmm. Yeah, that's for sure. And that's why I'm really looking forward to this, because as a nurse practitioner entrepreneur, that's a combination of words that you don't hear together, and I really love it. I want to jump in and we talk about the learn segment.
Mm-hmm.
Tell us a little bit of background around NNPEN and what building that community has actually looked like, and then we'll dive into the learn segment a little bit more.
Thank you for allowing me the opportunity to talk about the National Nurse Practitioner Entrepreneur Network. We actually formed it in response to the fact that we get no business education and training. As we go through our programs learning to be nurse practitioners, we get very little on how to build a business and how to sustain it. And when we get out of school, a lot of us are disenfranchised with the current healthcare system and want to open up a practice. But they're saying to themselves, I don't know where to start. Who do I call? How do I figure this out? So myself and my business partners really created NNPEN as a community that provides education on business. We have a 12-week business basics accelerator course that gets you the foundational experience that you need to open up your doors. You complete it, you get your full business plan, so you're ready to push play and get everything rolling. It's taught by content experts too, so you're not just hearing it from, hey, I'm a nurse practitioner, I'll teach you what I know about business. It's really from a marketing, CPA, an attorney, all of those pieces. So we're proud to be offering that, and we're into our 12th iteration of the course. So people are taking this and really getting their programs and practices established. We also recognize that we don't know everything, so we partner with a lot of different companies who really understand nurse practitioners. We function a little bit differently in how we care for patients. We look at that whole person care from a population perspective. Doesn't that sound a lot like value-based payment?
Mm-hmm.
Because it is. So we need seats at the table. We need to be in the discussions where we can look at how can we support that NP practice owner to be the most efficient clinician, being able to be sustainable in their practice and being able to expand their reach so that we can really take care of more patients.
I love it. Yeah. It's phenomenal because I'm a plant-based individual, and I always point out that the doctors receive very little nutrition training. Like you get out of nursing school or doctor school, whatever that graduating is, and there's so many things you still don't know and you have to learn. And that's where I say, as we head into this learning segment of AI, from where you're sitting with NP practice owners across the country, what's something you've learned about AI that genuinely shifted like how you're thinking healthcare delivery or practice management or these business nutrition skills? AI can help with those, right?
Absolutely. I think one of the great things that happened with N and Penn is that we got outside of nursing. So we were able to go to Vive and we were able to attend Health, which are trade shows, and really get the information out there about who nurse practitioners are and what we're trying to do and changing the trajectory of healthcare delivery. But it also opened my eyes to see that there's a lot of people out there who want to help in healthcare, whether it's software, an app development, a new device, and they're looking for clinicians to potentially, test those devices out or, learn from us about what we need to be more efficient, to be better clinicians overall, to be able to harness the power of technology so that we can see more patients.
You mentioned some of the courses that you're taking people through. How do you see AI playing into some of those courses as they go? Is that becoming part of your curriculum? What does that look like?
Absolutely. We actually are hosting a conference and we're having a whole segment on AI optimization and how, a nurse practitioner can learn more about it and can leverage the opportunities that AI brings to their practice. One of the things that we're seeing in technology with AI is it's helping us to communicate better with our patients. We have real-time access to protocols and guidelines to help us manage our patients better. We have devices that can connect us with our patients remotely so that we can get real-time access to vital signs, for example, and other health monitoring measures that we need to keep our patients healthy. And our goal really as NPs is to keep people out of the ER, out of the urgent care, and out of the hospital, because that's where the costs go up. And if we can keep people in their homes, go to the employers, that's where we're going to actually affect better quality outcomes and keep the costs down.
Absolutely. So, what advice would you give to practice owners who want to start using AI but feel a little overwhelmed on where to begin? I know you and I have had multiple conversations on this topic, so tell others.
Well, first of all, do not fear AI. It's here to stay. And I think we need to embrace the technology and really educate ourselves as to what the technology can do for us and help us to become more efficient, to become better clinicians overall. There's a lot of noise out there right now from people who want to help NPs. So I think we're trying as NPen to filter through some of that to really connect with folks who understand AI, the technology, plus the nursing model of care delivery so that we really can look at products that are really going to enhance what NPs can bring to their businesses.
Yeah, some great points there. I think healthcare might be the most important place to get AI adoption right because the
Mhm.
stakes are so much higher than in most industries, right? I think a lot of people are really going to connect with that.
I think the one thing that AI also helps too is it helps us individualize the care for our patients, utilizing the technology in that way. And that's really what our quality outcomes look at, how well we keep our patients healthy, if they have chronic diseases, how well we're managing them. And all that is tech driven in this. And I'm really excited that people are looking to nurse practitioners to be kind of the innovators in some of this space and to really look at what do NPs need as entrepreneurs and business owners so that they can utilize this technology to their fullest.
Absolutely. As we pivot over to the leveraging section, anybody can say use AI to improve patient care, right? But what does it actually look like when it's working inside a real NP practice or health organization?
A lot of it can be managing your front desk. You can have
Hmm.
virtual assistants that can actually help organize your day. You can look at it from a clinician guideline perspective. Am I giving the best care possible to that patient? And you can get those real time answers immediately, which we used to have to research all of this and bring the patients back. Now it's in our hands. We can actually utilize that. I think the biggest use of AI technology really is in the scribes. That's the most obvious thing people see, that their conversations can be recorded during a visit and that can be populated into your electronic health record, which I think is amazing. So that's like one part of what AI can do, but it goes way beyond there.
Hmm.
I would love to see it be even more utilized in the reimbursement space so that we can utilize that technology to help us, audit proof our notes so that we're not harassed by the insurance companies all the time.
If we try to pull out an example or two, I know like in your day to day, you're delivering hepatitis C care inside of addiction and rehab centers, right?
Hmm.
Environments that are very probably resource constrained, highly complex. Is there any like before and after examples that you might have where AI has helped you do more with less in that kind of a setting?
Absolutely. I think the technology has helped me to be more streamlined in my ability to orchestrate the care that I give to patients with Hep C. It's done majority by telehealth. So I'm utilizing that technology in my practice. Also, there's a lot of concerns with drug-drug interactions, using the technology to help figure that out, and then using it to document the care that I am providing for the patient, and then sending the claims over to the insurance company. I mean, there's AI touch points on every aspect of the care that we provide.
People don't realize like the NP practice owners are sometimes just one man bands, right? I mean, they're
Mhm.
wearing 10 different hats: clinician, business owner, billing manager, HR. Have, you've gotten to speak to so many of them. Where does AI actually make the biggest dent in the workload? Or what's the easiest first lift that you see them embarking on as they lean into AI?
I think the biggest area, and you brought up a great point, a lot of our MP practice owners are solopreneurs. They start out either as a side hustle while they keep their day job, or they end up creating their business and transitioning over to full time practice ownership. But a lot of times, the use of some of this technology really helps them to be less concerned about the day to day operations, so to speak, because AI technology can help with that. But it also helps to enhance the ability to make sure that we're being efficient and being sustainable. Because one of the problems with nurse practitioners is that we create these businesses, but we need them to be sustainable. So, how can we be effective in managing that and utilizing technology to help look at, for example, a financial dashboard? What's my payer mix? What is my accounts receivable? Am I providing services that are still high value to the patients that I serve? Can I add new technology in? What's the cost? And I think that's the other realization that nurse practitioner entrepreneurs have to face, is that this technology, though it's helpful, oftentimes is out of reach cost wise to a lot of clinicians. So I think right now, because AI is being utilized a lot more, the cost of it is coming down. So I think nurse practitioners are able to see the value in it a lot more now than they could previous, because they can actually afford to use the service.
I love that. And if I tease that out a little bit, the powerful part about that example is it shows that AI in healthcare isn't just the clinical side like everybody keeps talking about it. It's about giving those practitioners back their time and
Mhm.
some mental bandwidth to actually focus on the patient in front of them. And I think that's a really important reframe that you touched on.
Absolutely. And that's one of the things that NPs do very well, is we partner with our patients. So we understand what their needs are. And then we can use the technology to help support the plan of care that we're providing for that patient too. And really utilize a lot of the support resources as well to help us be offering them the best care possible. Ideally, like I say, we want to help to keep them to their optimum level of wellness out of the ER, urgent care, and hospitals. So, and people want that. They're hungry for that. So we really have the opportunity as MP practice owners to be in the communities helping these folks, going to the daycares, going to schools, going to employers
Hmm.
in our communities. And I think that's where the beauty of healthcare is going to change, is really from our small practices at the grassroots level in the communities that we serve, really changing the whole narrative of healthcare and really putting the let's keep people healthy, let's prevent diseases, let's hit them early so that we can provide long-term survival.
We're going to pivot over to the last segment on the show, is this leadership moment, right? And honestly, this is the one I'm most curious about with you, Lynn, because your whole career has really been about leading change in a system that I think resists it, right? You're helping, you have helped push the full practice authority throughout Connecticut, right?
Yes.
You're building a national network for a profession that doesn't have one. I think that just showcases the special kind of leadership that you're bringing to the table. So here's what I'm seeing across the board right now. AI is shifting these power dynamics inside of every industry, including healthcare, where you and I work. The
Mhm.
practitioners who are using it well are pulling out in front. The ones that aren't are going to get left behind.
Yeah.
And healthcare leaders are caught in this middle of trying to figure out how to bring their teams along without creating the fear and confusion, as we talked about previously. So, how do you think about that challenge? And how are you helping NP leaders step into this AI moment with confidence?
One of the big things that we're trying to focus on at NMPen is creating an MP ecosystem. Like, how are we going to create that bubble that an MP practice owner can be part of that gives them all the tools that they need, the education, the resources, the support, the technology to be the best solopreneur or entrepreneur in expanding their business? How can we do that
Mm-hmm.
as an organization and take that lead? We also have a directory. One of the things that we find is that we don't know where all these beautiful practice owners are that are providing this wonderful care because we've been doing it in isolation. We've been doing it invisibly, under the cloak of invisibility. And we need to bring that out to the forefront now more than ever because we are the ones that are taking care of the underserved, underinsured, Medicare, Medicaid. But people are looking for NP care. So our directory, www.mpdirectory.org, a nurse practitioner can put in their NPI number. It pre-populates all their information. And then if they put their practice NPI, they get a dot on a Google map. So
Mm-hmm.
patients find them. That's one thing, we hear from our NP practice owners is if I build it, will they come? Absolutely. But this is a way that patients can find us. And then nurse practitioners can find each other for collaboration, resource sharing, et cetera. And students can find preceptors because we know these NPs want to go back to be a practice owner. And if we can pair them up, it could be a new employee source for an addition to the practice. If they turn out to be a really good student, they might want to hire them. So there's a lot of opportunities for NPs that NMPen is taking the lead. And we, like I say, like to partner with folks that understand healthcare. And we have a conference every year and we really focus it on business. And I'm excited this year because we have when business meets clinical. Like, who would have thought to put the two together? But we're doing it in Florida and Tampa. And some of the things that we're going to talk about is, legal aspects. We're going to talk about financial literacy. We're going to talk about blurring the lines for mental health care. We're going to talk about AI optimization. We're going to talk about introducing acupuncture into your repertoire because it's a lost art. So there's a lot of opportunities through NMPen that we're trying to get our practice owners to recognize the value that we bring to them through our connections and our policy and our advocacy as well.
I love it, especially that AI track. I'm hoping that helps a lot of people realize the value of how they can leverage that to buy back some time and optimize their practice a little bit. I'm curious, like, you know, in a system that wasn't really built for them, NPs have to advocate for themselves quite a bit, right? Does that advocacy muscle that you have got down pat so well translate into how you're thinking about AI adoption?
Absolutely. And I think one of the key points is if we can leverage the collective, so a practice owner of an N of 500 or 1,000 patients, nobody's going to listen to them. But if we have 500 practices with 500,000 patient lives, now we're going to get some attention. So I think that's where the leveraging comes in. And our hope is that it will help us to be able to be seen, heard, visualized, and recognized as healthcare leaders so that we can look at technology built for NP, value-based care, nursing model, population-focused delivery, because that's what we do. So that's the whole point of creating this NP ecosystem is really looking at how can we have all the tools together that benefit an NP practice that keeps us sustainable at a cost that's reasonable, but allows us to serve the populations that we need to in order to change healthcare. Because right now it's a really broken system that's too expensive, and we keep throwing money at it, and we're throwing money at the wrong problem. We need to not focus on the disease, but we need to focus on the person that's having the disease. That's what we need to focus on. And I just wanted to say, too, for those of you who don't know, Brian is actually going to be talking about AI at our conference. So I'm very excited that we're going to have your expertise there. I'm just really excited for the attendees to really hear from an expert in the field. So we really appreciate your ability to be there and support us.
I've been watching your journey, Lynn, and every time I talk to you, there's something new I'm learning and seeing how far you've grown in such a short time span with NNPen. So congratulations on a lot of that success. I mean, I'm just curious. I think we learn best through watching and examples and stuff, and as a leader in this space, is there a moment or two where you saw a practice owner or a leader that you've been working with really turn the corner and that AI light bulb went off and like something clicked for them?
Actually, there's several examples. There is one fellow nurse practitioner colleague who was the former past president of AAMP, Stephen Ferrara, who actually embraced AI technology early on. And after he completed his presidency with AAMP, took it upon himself to develop a course for NP entrepreneurs, and nurses who want to understand more about AI technology. So that's exciting. But also to see our practice owners, many that take our business basics course will start their businesses. And the last several that we've had, their businesses really exploded very quickly. So the growth potential, and that's where I think the technology with AI can be very helpful, because we could scale these practices much more expeditiously based on the needs in their communities if we use the technology appropriately.
Yeah. And I've heard, I want to play devil's advocate because I'm obviously on the AI with Bry podcast all in on AI, but I'm curious if you're seeing any devil's advocate kind of concepts around that AI isn't going to make healthcare better. There's no evidence that's really showing that it's going to make better decisions or directions, and these are all not the right promises and stuff. So I don't know, is your network talking about that? And do you have an opinion on, is it just a hype, or, is it just another version of electronic medical records that are going to drag us away from the patient?
I hope not. I mean, the patients really need to be at the center. And I think you can't take the heart out of healthcare. So to replace us, I don't think that that's going to happen. What I see AI as a tool to make us better clinicians overall. And to do that, you really need to understand the technology and to be able to utilize it appropriately. And I think just keeping education in the forefront, because this technology is changing every single day. There's something new happening. So I think you have to just keep your finger on the pulse of what's happening in technology as well, because it is changing so rapidly. And I think, again, us going outside of nursing and really talking with folks outside of the community has been very helpful for NNPen to be able to look at who we need to partner with and who's in alignment with what we're trying to accomplish overall with our practice owners and changing that trajectory of healthcare from illness model to wellness. That's what we're going to do to improve overall. And I think AI has a place for sure.
Yeah. As a CTO who's brought in the new EMR and had to tell nurses and doctors you have to use this new system, and having honestly seen people quit over it, I'm hopeful that AI isn't that same kind of shift for them, and they're looking forward to it, like actually letting them, document certain things and let them really be able to look the patient in the eye and spend that extra time with them, or get to know them a little bit better and build that connection with them. So are you worried that AI, just like EMRs, is going to push people away and make them like not want to do the career that they got into?
No, because anytime somebody's had an interaction with a nurse practitioner, I'll give you an example. When I was in practice, there was a patient who came in and was very upset because they were seeing the nurse practitioner. They wanted to see the physician. And I said, I'm sorry, you got booked with me. They should have asked you at the front desk. But that's okay. I said, I'll see you today and then we'll reschedule you with the physician if you don't mind. And they said, oh, no, not at all. And after the course of the visit, she said to me, she goes, I really liked what you did. You listened to me. You took the time to take and explain things to me. I never got that before. She goes, can I see you all the time now?
That's right.
So that's the impact, because we create that patient provider relationship. And we're taught that when we're in nursing school from day one. I mean, we spend so much time on the patient provider interaction. And that's what's missing in healthcare right now is that interaction. So AI is bringing it back, because we're now able to have somebody record the interaction. So we're not sitting behind the computer typing ad nauseum instead of listening to our patients. But on the other hand, I think it really, there are some concerns about, what happens with the data that is taken in with AI, and where's that going and who owns it and how's it being processed and managed and all of that. And I think really the biggest thing is ask a lot of questions. Be curious about AI. I think that's the biggest thing. Ask a lot of questions.
I agree completely. I think there's some really strong framing here that AI in healthcare isn't something that's just like happening to NPs. It's something an NP leader can pick up and use to finally get some strong leverage they deserve in a system that's underestimated them for quite a while. So I hope every healthcare and practice leader out there watching this hears that loud and clear right now. So thank you so much for being here, Lynn. Like, how do people get in touch with you? What should we put in the show notes? And tell us a little bit more about that conference in Tampa.
Sure. So they can reach me at lynn@nnpen.org. I do answer my emails, so please have at it. They can go to our website, www.nnpen.org. So that'll get you to the site, and there's a wealth of great information there, a lot of resources that are available for our NPs. We have monthly business meetings with psych NPs and the general nurse practitioner members. We also have office hours, which we're actually doing the third Tuesday of every month. It's a hot topic. You get a free CE for that. If you're new, you can sign up, you get that free CE, but it's always a hot topic, something relevant to practice ownership. And all of that's recorded, so we have it available. If people want to view it afterwards, they can go ahead and do that. Our conference, we do a conference every year. We're hosting it in Tampa, and it's a joint venture with FLAMP, Florida. They have a cohort of business owners as well. So we're working together with them and their organization to create a business/clinical conference. And we're excited because it is the first time that this type of conference is happening, where we're pairing clinical and business together. So you can flip between tracks. If you want the clinical, you can get that. If you want to go to the business talks, you can do that as well. And like I said, we have a great lineup of speakers, excellent topics, and you'll learn a lot. Our focus really is more on the interaction with practice owners within each session, so that it's not you're sitting there and just seeing a PowerPoint presentation. It really is the engagement that we do with our attendees. They really look forward to the conference, and they really get a lot of pearls of wisdom to take back to their practices as well.
I love it. That's perfect. We're going to make sure all of your notes, Lynn, are in the show notes, including nnpen.org and the NP practice directory. So you can click straight through. It's probably right down below this video. Everybody out there, if this episode gave you a new way to think about AI in healthcare or in your own practice, please pass this along. Share it with a clinician, a practice owner, or a healthcare leader in your network who needs to hear this. Please follow the podcast, leave us a review, and check out all the other ways to connect with Lynn down below. I am Brian Dunstead. You have been listening to the AI with Bri podcast. And remember, the future doesn't wait. Learn, leverage, and lead. We'll see you next week. Thanks again, Lynn. We appreciate you being here.
Thanks for having me.
This episode of AI with Bri was hosted and produced by me, Brian Dunstead. Produced with help from Nancy Velasquez and Kelly Lopez. Video by Leo Moralina. Sound AI generated. Find us on all platforms at AI with Bry and visit ai.bry.net for more. Learn, leverage, lead.